So next we have Streptococcus pneumoniae. This is an encapsulated bacterium. It can be alpha or beta hemolytic, depends on the strain. It produces a toxin called pneumolysin, which not only degrades hemoglobin, but it also destroys ciliated cells and phagocytic cells. So if you think about the anatomy of the respiratory tract is lined with ciliated cells, and the cilia beat in unison to bring up mucus from the lungs and bronchioles to eventually dump it down the esophagus to be degraded. So any dirt or microorganisms that get trapped in there should be moved up by those ciliated cells and dumped down to be destroyed, digested. The other thing that you have to think about inside of the respiratory tract is the lymphoid tissue, the mucosal associated lymphoid tissue, MALT. And one component in the respiratory tract are alveolar macrophages. So we're basically talking about a bacterium that can destroy your red blood cells, destroy the cells you need to get rid of mucus and infection in the lungs, and destroy the phagocytic cells that would help clear up anything that's still got stuck. So this can be a rather tricky respiratory infection. With alpha hemolysis, what you tend to see is not a complete zone of clearing, but you'll see usually some kind of green area surrounding the bacteria. So it colonizes the respiratory tract, as you might imagine. One thing that's tricky about this, though, is that it often is a normal resident of the upper respiratory microbiome. It's only when it gets down into the lower parts of the respiratory tract or you have some sort of complicating factor that this can cause an infection. It produces a protease called IgA protease. And so in your reflection, I want you to think about why that's important. Why is it important that it specifically produces an enzyme that breaks down IgA instead of all of the other antibodies? And as I previously mentioned, this is a really common resident of the throat and nasopharynx. The major symptom of a patient who has an actual infection, not just standard colonization, is going to be pneumonia. We'll have what's called a productive cough. So a productive cough is one that comes with mucus. Because of the destruction of the cells in the respiratory tract, blood can get in there, and so you'd often see blood-tinged sputum, and this will cause pain in the patient. This is generally associated with what's called aspiration or lobar pneumonia. So you've inhaled and gotten that, like maybe sometimes if you inhale food, that's aspiration pneumonia, but it tends to be more of a like localized pneumonia rather than spread to both lobes of the lung. This is also one of the most common causes of middle ear infections and sinus infections. So here we're looking at a middle ear infection. You'll see this can cause significant swelling of the eardrum. It can cause eardrum rupture. And the reason for that is because it's a normal resident of the sinuses. If you have something like a cold, or with children, they have very, very small, they're called eustachian tubes that allow the ear to drain. When those get blocked, the bacteria that normally are in there can just grow and they can't drain out. And same with the sinus infections. The passages can swell and not allow drainage, and so you get that kind of buildup of infection. For patients who have untreated ear infections or untreated sinus infections or head trauma, this bacteria can cause meningitis. And so that's what they're showing here. There's a greenish layer of pus covering the brain. There's, kind of these red lesions, hemorrhagic foci. So obviously this is a patient at autopsy who died of Streptococcus pneumonia meningitis. And then of course bacteremia can follow pneumonia or meningitis. If these are left untreated, the bacteria can get into the bloodstream and there they'll really wreak havoc. So Streptococcus pneumoniae causes pneumonia. So a woman, 68-year-old woman, was in good health until 3 days before hospitalization. She developed fever, chills, weakness, that productive cough with the chest pain kind of deep in the chest cavity. She had a fever, elevated heart rate, elevated respiration. She was in moderate respiratory distress. She had abnormal white blood cell count, low red blood cell count. She was in acute renal failure. Chest x-rays demonstrated infiltrates in the right and left lower lobes, so right in the lobes. She was treated with a fluoroquinolone. Blood and respiratory cultures were positive for Streptococcus pneumoniae. Additional tests revealed that the patient had multiple myeloma, so the patient has cancer. The patient resolved the infection after a 14-day course of treatment. This illustrates the typical picture of pneumococcal lobar pneumonia, so in different lobes of the lung, and increased susceptibility in infections with patients who have defects in their ability to clear encapsulated organisms. So because of the cancer, that caused the immune suppression and made it even harder for her to clear that infection with the encapsulated bacterium. Streptococcal pneumonia infections can be treated by microscopy if an area is supposed to normally be protected. So in an area where you shouldn't find Streptococcus pneumoniae, so you should not see any sort of gram-positive coccus, if you do microscopy and you find a gram-positive coccus, that can be pretty diagnostic. You can also do detection of the C polysaccharide, so this is group C strep basically. And of course you can do PCR. Antibiotic therapy should be done with vancomycin or maybe even ceftriaxone. There's increasing resistance to penicillins, macrolides, and cephalosporins. But of course, most recommended would be vaccination. There is a pneumococcal vaccine recommended for children and the elderly. So if we look at some of our data from the CDC, again, this is from 2017, so they haven't released an updated report yet. Erythromycin-resistant group A strep, 5,400 infections, 450 estimated deaths. Clindamycin-resistant group B strep, so Streptococcus agalactiae, 13,000 infections, 720 deaths. And drug-resistant Streptococcus pneumoniae, 900,000 infections in 2014, 3,600 deaths in 2014. So finally, just a couple slides on the enterococcal infections. The two most common species that you would see in human patients are going to be Enterococcus faecalis and Enterococcus faecium. These are grouped with the Streptococcus because they used to be considered group D strep. But molecular analysis has revealed they're a little bit more distantly related, so they do belong into their own genus. They lack many of the other virulence factors that like strep or staph would have. However, they do have adherence and, of course, antibiotic resistance. Most commonly, we see enterococcal infections as hospital-acquired infections, and those manifestations tend to be urinary tract infections, septicemia, and endocarditis. It's recommended that patients who have enterococcal infections be given combined antibiotic therapy because of the increasing commonness of vancomycin-resistant enterococcal infections. So this is a case study of enterococcal infection and the difficulties in treating a patient who has endocarditis. So this is a 40-year-old man with hepatitis C, hypertension, so high blood pressure, and end-stage renal disease. So there are a lot of complicating factors here, who developed fever and chills during hemodialysis or just, dialysis, where patients who have kidney disease go in and their blood is filtered by a machine for them. In the 2 months before this episode, he had been treated with ampicillin, levofloxacin, and gentamicin for group B strep endocarditis. Cultures performed during hemodialysis grew Enterococcus faecalis that was resistant to levofloxacin and gentamicin. Because the patient had an allergy to ampicillin, he was treated with linezolid. ECG showed vegetation on the mitral and tricuspid valves, so basically on multiple valves in the heart. Over a 3-week period, the patient's cardiac output deteriorated, so he was desensitized with ampicillin. Basically, when a patient has a penicillin allergy, you can sometimes perform desensitization, which is with a lot of allergens you can do this, but of course you would never do this on your own. You would only do it under medical treatment. And the patient was switched to ampicillin and streptomycin. After 25 days of hospitalization, the patient's damaged heart valves were replaced and therapy was extended for an additional 6 weeks. Thus, use of broad-spectrum antibiotics predisposed this patient with previously damaged heart valves to endocarditis caused by Enterococcus, and treatment was complicated by the resistance of the isolate to many commonly used antibiotics. So he already had group B strep that caused endocarditis, which damaged the heart valves. And then because of all of these other complications he has, hepatitis, high blood pressure, renal disease, he was prone to get more infections. And so this time he got Enterococcus faecalis. So these are things you have to think about, because often, a patient might come in for a major issue. The patient comes in for, dialysis, my kidneys are failing. But what other complicating factors are there? So hepatitis C and high blood pressure that could also put this patient at risk for other things. So you can't ever look at a patient's diagnosis as like that's the only diagnosis. You have to look at everything as a complete picture. So again, from the CDC, vancomycin-resistant enterococci, VRE, 54,000 estimated hospitalized patients, 5,400 deaths, which led to an additional $540 million in healthcare costs. So again, these are pretty dangerous infections that are increasingly antibiotic resistant. And so as a healthcare provider, it's really important that not only are you aware of these antibiotic resistance trends, but that you are competent in diagnosing the different infections and can think about how to do testing to determine which antibiotics you should use, and then finally, which antibiotics should you use. So again, it's really important for you to be able to differentiate between staph and strep, between the different strep species, between strep and enterococcus, as you are thinking about studying for your exam and doing your reflections.